Occupational hazards of leather and tanning industry workers. A 52-year-old male presents to his family physician with repeated episodes of headaches, mostly frontal, heaviness on both sides of the nose in maxillary sinuses region, occasional blood-stained nasal discharge. He showed his hands and complained of dryness of the skin with history of blister formation in the past. His physician took a brief history, examined him, and told him that he was suffering from chronic sinusitis and allergy of the skin, which is commonly seen, and prescribed treatment for the same. The physician unfortunately failed to ask the patient one simple question: what exactly is the nature of your work? If that question had been asked, then the physician would have known that he is dealing with a leather tannery worker who is prone to nasal polyps and cancer of sinuses due to exposure to chromium in his work. Effective history taking has long been identified as a core discipline in treating patients. Spending more time compiling a good patient history has been known to provide the most benefit as compared to long physical examinations and expensive laboratory tests. Collecting an incomplete history can affect initial therapy and all subsequent decisions for treatment. Therefore, it is essential that primary care physicians ensure that neither the patient nor the health system is unduly burdened by deficient history taking. Primary care providers and family physicians can play an important role in improving the recognition of occupational disease, preventing progressive illness and disability in their own patients, and contributing to the protection of other workers similarly exposed. This role can be maximized if physicians raise their level of suspicion for workplace disease, develop skills in taking occupational histories, and also learn basics of advising prevention. Leather tanneries are spread all over India and account for 10% of the world's leather production. They accounted for production of $11 billion worth of leather goods in 2013-14, out of which $6 billion came from exports. India boasts of 21% of the world's cattle population and also has 11% of the world's goat and sheep population. Indian government has offered several incentives to boost this industry. Despite contributing such high revenue to the Indian economy, most of the tanneries pose health risks not only for their workers but also for the surrounding environment, as there is no awareness amongst the regulators, tannery owners, workers, and also primary physicians about the health risks posed by the tanning process. Distribution of workforce. There is no extensive survey that points to a rational assignment of the workforce to dedicated work processes. Tannery workers are multitasked and participate in all the work that forms part of the tanning process. Characteristics of work. The principal nature of work pertains to tanning hide into leather, thereby permanently altering the structure of the hide. Making raw hide, which is untanned, but a worked hide is a process by itself before sending the hide for tanning or processing with tannin. The tanning process involves treating raw hide with treatment with chemicals that may either be vegetable sources, such as naturally occurring tannin present in barks and leaves of some plants, or chromium compounds which definitely are toxic in nature. Methods of work or operations involved. The tanning process mainly comprises of A. Skinning and curing. B. Beam house operations. The steps in leather manufacturing between the cutting and tanning processes are together called beam house operations and comprise 1. Soaking. 2. Liming. 3. Unhairing and scudding, in which agents such as sodium sulfide, sodium hydroxide, sodium hydrosulfite, calcium hydrosulfite, dimethylamine, and sodium sulfhydrate are used to treat the hide. Hair is then removed through machines, but when it is done manually using a dull knife, the process is called scudding. De-liming and baiting. De-liming is a process whereby the pH of the collagen acting on the hide is lowered so that enzymes may act on it. The process of softening the hide by treatment with enzymes is called baiting. Pickling. Once baiting is complete, the hides and skins are treated first with salt and then with sulfuric acid in case a mineral tanning is to be done. This is done to bring down the pH of collagen to a very low level so as to facilitate the penetration of mineral tanning agent into the hide. This process is known as pickling. In vegetable tanning, naturally occurring compounds such as tannin found in barks and leaves are used. Chrome tanning is done using various types of chrome. Worker exposure and health consequences. Workplace exposure to hexavalent chromium and compounds. 1. Lung cancer in workers who breathe airborne hexavalent chromium. 2. Irritation or damage to the nose, throat, and lungs if hexavalent chromium is inhaled. And 3. Irritation or damage to the eyes and skin if hexavalent chromium contacts these organs. Workers can inhale airborne hexavalent chromium as a dust, fume, or mist, while, among other things, producing chromate pigments, dyes, and powders, such as chromic acid and chromium catalysts, working near chrome electroplating, performing hot work and welding on stainless steel, high chrome alloys and high chrome coated metal, and applying and removing chromate containing paints and other surface coatings. Skin exposure can occur while handling solutions, coatings, and cements containing hexavalent chromium. Health problems and disease patterns. There are numerous safety hazards in leather tanneries and work that is known to be high-risk activities for the safety and health of the workers. Workers in the leather industry face the risk of physical injury due to accidents or exposure to various noxious agents, particularly chromium. Exposure to chromium can have far-reaching consequences on the health of the affected persons as well as their ability to lead a normal life. Health conditions and causative sources. Let us now review health hazards of the workers with their causative sources in the work and manifestations. Respiratory conditions. These arise mainly due to chromium exposure and can have far-reaching consequences on the health of the affected persons as well as their ability to lead a normal life. Polyps, sinus cancer, nasal cancer. The causative sources for the same are the following. Leather dust. People involved in raw leather production as well as those working in the shoe and boot manufacturing industry are at an increased risk of cancers of the nose and the paranasal sinuses due to high degree of exposure to leather dust. Chromium dusts or fumes containing chromium. Chromium-6 or hexavalent chromium may predispose the development of nasal and sinus cancers. Smoking and second-hand smoke may also be contributory factors. Pneumonia. The usual causative source is chromium fumes. Lung cancer. Causative source. Exposure to hexavalent chromium compounds is a major predisposing factor. Injury conditions. Fractures and other mechanical injuries caused by slips and falls. Causative factors. Improperly drained floors and improper lighting. Drowning and suffocation. Causative factor. Improperly covered storage tanks. Cuts and lacerated wounds. Causative factor. Injuries due to flaking knives. Simple preventive measures to prevent injuries that can be adopted are keeping all instruments and apparatuses properly covered with guards and wearing protective clothing or gloves. Providing a first aid kit in the premises should be mandatory. Neoplastic conditions. Skin cancer, caused by dermal exposure to hexavalent chromium, leads to irritation and ulceration due to its corrosive action and predisposes to skin cancer. Bladder cancer and kidney cancer. Causative factors. Exposure to aromatic amines and benzene-based compounds in tanning, liming, and dyeing of leather predisposes to bladder cancer. Dyes and pigments can also predispose to kidney cancer. Pancreatic cancer. Causative factors. Workers involved in drying and painting or dyeing of leather risk exposure to formaldehyde and to high dye direct black 3-azo dye and solvents. These could initiate DNA mutation and, along with the action of chromium-3, promote pancreatic cancer growth. Smoking is also a predisposing factor in pancreatic cancer development. Testicular cancer. Causative factor. Exposure to dimethyl formamide or DMF, a substance known to cause testicular damage. Prevention of occupational diseases and injuries in leather and tanning industry. Based on the surveys conducted on the prevailing occupational safety and health standards at work in tanneries in China, India, Indonesia, and Nepal, the key challenges faced by the industry in all these countries were found to be: 1. Lack of awareness of existing health hazards and safety risks and their impact. 2. Limited know-how on how to deal with these in an appropriate way. 3. Manufacture of leather from hides and skins involves use of a large number and variety of chemicals, machinery, and equipment. 4. Floor in typical traditional tanneries in this region is generally found to be perpetually wet. The problem areas pertaining to occupational safety and health of workers have been identified as to potential sources of hazards include: safety in use of chemicals at work. 1. The level of knowledge about proper storage and handling of particularly hazardous chemicals is very low. 2. Measuring and mixing of chemicals is done manually in the small-scale tanneries. 3. Process control is generally absent. 4. Access to safety information on hazardous chemicals is limited. Material safety data sheets are not automatically provided with the chemicals, as is the common practice and requirement in the industrialized countries. 5. Even when provided, information from material safety data sheets is not translated into preventive or protective measures nor adequately explained to the storage and handling personnel. Machine safety. 1. Machines locally manufactured generally lack basic safety installations such as active and passive safety devices. But these machines are used by most small and medium-scale tanners because they are inexpensive. 2. Standards of machine safety, therefore, are particularly low in these segments. 3. Manufacturers supply these machines of old unsafe designs as these are demanded by their customers. 4. Besides the safety risks, these machines do not allow achievement of high quality standards too. 5. Improper design and poor maintenance practices result in exposure to high levels of noise. A significant percentage of workers and supervisors have partial hearing impairment. 6. Equally, poor quality and unsatisfactory maintenance of electrical installations, inadequate for the corrosive and humid work conditions in tanneries, leave workers at high risk of electric shocks and fatal accidents. Control of workplace parameters. 1. Missing or inadequate local extraction systems for spraying vapors, mist, and dust result in exposure of workers to such hazards beyond occupational threshold limit values. 2. Little attention is paid to measures which might contribute to improved quality or productivity, for example, proper lighting, workplace layout, alternative means of handling material, improved housekeeping, etc. 3. The above conditions are aggravated by an unsystematic growth of many tanneries. 4. At present, these leave little room for carrying out improvements to achieve overall better natural ventilation or illumination without major capital investments. 5. Personal protection and emergency preparedness. The limited knowledge and awareness about the existing health hazards and safety risks at work result in a corresponding inadequate protection of tannery workers as well as unsatisfactory preparedness for fire or medical emergencies. Many factors, mostly unhelpful, which exist and which prohibit speedy adoption of improved practices include: 1. Many small and medium-scale tanners usually do not perceive occupational safety and health at work as a real issue. 2. In view of its insularity, the tanning community is less likely to look for outside help. 3. The tanners may be even hostile or lukewarm in their response to training and outside assistance, with little trust in academic lectures and lessons. 4. Main concern is to maintain business or solve routine problems with limited time and resources for activities not directly linked with production, marketing, and short-term profit. 5. They may have a low awareness and limited knowledge of ways for improving occupational safety and health standards at work. 6. Being often small companies, the owner-tanner may have an autocratic management style in which motivating or training workers is considered a waste. General principle of prevention of occupational diseases and injuries. Simple protective measures like simple dust mask, eyeglasses, use of hand gloves, and hand washing practice can be effective. Preventive interventions require strategic contribution and efforts from government through occupational health and safety policy and legislation, cooperation from employers as well as workers, and advice from medical professionals. Occupational diseases manifest after long latency period from the time of exposure. There are challenges to establish and declare that a disease is due to hazard at workplace. Elaborate guidelines for management and prevention of occupationally caused diseases is beyond the scope of this documentary, as currently there is no mechanism for doctors to enforce their recommendation without a statutory backing. We therefore give general principles of prevention. Preventive measures should be designed and implemented at 3 levels of prevention. 1. Primary prevention aims to reduce the occurrence of disease by eliminating the cause of disease, for example, use of benzene-free solvents or solvent-free paints to eliminate the risk of carcinogenicity, or reducing exposure to safe levels that prevent it from causing damage, for example, reducing noise at its source to levels that do not cause noise-induced deafness. 2. Secondary prevention to identify and treat health problems as early as possible, often before symptoms have developed, in order to take corrective action. For example, regular audiograms among workers exposed to high levels of noise in the work environment. 3. Tertiary prevention aims to avoid complications of and disability from illnesses and injuries and/or to provide rehabilitative and palliative care. It aims to minimize the consequences in persons who already have disease and depends on appropriate treatment. We expect that the primary care physicians are already well versed with clinical knowledge for management of the occupationally caused health conditions. To learn more about detailed clinical perspective, treatment and prevention and control, please refer to e-book or printed version of BOHS for informal industry, manual for primary care providers. So, if your next patient with any of the presenting symptoms we described earlier comes for treatment, please don't forget to ask him the $1,000,000 question. What exactly is the nature of your work?